There, I could feel it just coming down.
Yeah.
Yeah.
There you go. Good job. There it is.
Hey, yo.
So I know we're talking about that hip on the right, correct? Can you show me where? Can you point to where it's feeling the pain at?
Right here?
Right on that right
all
side.
the way down.
It goes down. Does it go down into like the calf? Down
All the
into
way down
feet?
to my ankle.
Oh, down all the way
Yeah.
to the ankle. Okay. Now I know we talked about your right hip and your leg having that sciatic type pain. Any issues up in the neck, the mid back?
No, just a little tight, but
Tightness,
you know, very
stiffness.
tight.
Yeah, it's pretty common. I mean, you have quite a bit of arthritis looking at the x-rays. And when you have the arthritis, the degeneration in the joints, a lot of times patients, it's so crazy because you look at someone like, man, this person's going to be dealing with a lot of pain. But they may not actually feel pain. But like you mentioned, like some tightness, some stiffness, a lot of things might be going on, but pain may not be something that everyone always feels. Would you consider yourself that having a higher pain tolerance?
I think so.
Sometimes?
Yeah.
Yeah. A lot of times people have different sensitivities. You know, like when people get ticklish?
Mm-hmm.
Some people are super ticklish, and then some people are like, no, I don't really feel anything, you know?
Yeah.
Same thing with pain. You know, pain is something that it's different for everyone. Some people are really sensitive to pain, and so because of that, you know, their skill level in pain is like super high. But if you're not feeling too much pain, it could also be that you have a little bit of a higher pain tolerance. Just like some people have a little bit of a ticklish sensitivity. So what I'm doing is I'm measuring for the inflammation, a little bit of pressure right in this mid-back area. And so we don't ever want to guess on the spine. We want to know exactly what's going on. And I always tell people if it's not broke, you don't fix it. So if we can work on the areas that need to be addressed, that's what we want to focus on. The lower back, the hip pain, that's been going on for how long?
Oh, it's been over 2 years, I think.
A couple of years.
Yeah.
Do you feel it more when you're walking, sitting, standing, moving?
It hits me at different times. I could be standing for a while and then I feel it, or I could be walking, then I get the pain. Okay, so we are seeing a lot of inflammation shooting over to that right side. Mm-hmm. So we have a couple different spots here. Now one, this is going to be your SI joint. So your ilium and your sacrum. This creates the sacroiliac joint, so your SI. So this is your upper joint up here. We have your middle joint, and then we have your lower joint. Any pain there? Right there, I could feel a lot of pain.
Okay.
Then in the middle.
In the middle as well.
Yeah, and then the bottom.
And the bottom too.
Yeah,
Okay,
right
so the whole joint.
Yeah, but it goes from top, bottom, and then middle.
Gotcha. I'm going to push into the sacrum. So this is your sacrum down below. I'm going to favor that right side here. Is that sore as well?
A little bit.
But more so on the,
yes,
that
right
joint.
there. Yeah.
Okay.
And right there is probably the
1, 12, 11. Any pain or soreness there?
a little bit, yeah.
A little bit. Which
No.
is the worst? 11 or 12?
12.
12. Okay. Yeah, we got some pressure in there. 2, 3, 4, 5, 6. Here's 6, 7. 6, 7. 6 on there.
Mm-hmm.
Okay. I might start with your T12 here. This one, it's just a little reading here. Oftentimes if we can work on this, that will start to clear up some of that stress. But we might need to work on that as well. But I know, Sam, talking about your x-rays, we have a lot of arthritis and bone spurs developing on that right side over here. On the left as well, but mostly up on here. So there's only so much movement we're going to be able to get from these joints, but we're going to go ahead and see if we can open pressure off of that, okay? This one here, chin down a little bit. There you go. I'm going to press onto your C6, C7, 6, 7. Any soreness there?
Yeah, both of them.
Okay, let's take a look at the movement here. 6, 7, 1. Yeah, we're going to do 7. We got your 12. This guy here, though. Now, when you feel the pain, do you feel like it's more down at the bottom of the glute or more in the upper part of the glute?
It depends which way you were moving it. There, I could feel it just coming down.
Yeah.
Yeah.
All right, so what your x-rays are showing is that your pelvis is basically rocked forward. As it rocks forward, it's going to put that stress on that joint right here, and it's going to cause that sciatic nerve to shoot down and cause some pressure down into your leg. We're going to see if I can bring that down, see if I can push that down where we need it to be, okay? So we'll see what we can do for you, but I can tell it's going to be some work for you, okay?
Okay.
All right, and you're going to bring up your right arm for me. Arm down, good. Yeah, okay. So we're going to go right over here on your C7. I'm going to bring down just a little bit more. relaxing that shoulder. You give a little bit of a push, just like that. Let it go. Little baby one. A little bit more. Chin up a little higher. There's the rest. All right. That first one's like a little click. This right side a little more of a clunk. That's what I'm looking for. Bring up the right arm. We got some work to do though. You all right?
Okay, yeah.
All right, good. So let's get you on up a little bit. This leg's gonna be right on over here. This one's gonna go straight. There you go. So this guy, again, it's shifting forward. I'm gonna bring that thing back down so we can open up and at least release some of that pressure on that leg there, okay? Okay, bring up this here. Perfect. Perfect. You go right here, 1, 2. All right, it's gonna be a little sore, okay? But you'll be just fine. Right there, let that shoulder go. There you go, good job. Let's have a seat. Coming up. You're doing just fine, man. You doing okay?
Yeah.
All right, so do me a favor. Go and stand for me. You're gonna walk over here. I'm gonna actually have you walk towards these joints. Just get some movement in that joint. And then right back on over here towards these chairs. And leave some space for you here. Where your spine curves down into a lordosis, then it transitions back into a kyphosis, where it kind of goes the opposite direction. This area can tend to be a weak point for your spine. So we're going to see if we can get some stability in there by getting that to set back where it needs to be. So 5, 4, 3, 2, 1, and then we have 12. Now you're going to take a deep breath for me. And let it all the way out. Relax the shoulders. Nice and easy on that. Good job. Sometimes I'm always wondering how they're going to respond, because sometimes these joints have been stuck for such a long time that they don't move as easy. Okay, so this is already starting to move much better. So we're going to see how your body responds to that. It's going to take some time for us to start getting that pressure off of it. But the biggest thing is this, is like, imagine you have like a big stone and it just drops onto your foot. It's going to be painful. When I remove the stone off of the foot, it's still going to hurt, right? But the pressure's off of it, so now it needs to heal. The same thing with your body is when we shift and move some of that pressure off, the pressure's off, but now it's needing to heal. So that's kind of where we're at right now, okay? So we did 3 things here today. That pelvis, this is AS7. That means it's gone anterior and superior. It's putting stress onto that joint. That nerve goes from here down into the pelvis and into your leg. That's where you're feeling like that pain going in here. As we get pressure off of that and it starts to correct, what happens is it's going to want to pull back. That's why we have you on a plan here. As we get that to sit and hold where it needs to be, it should start to relieve some of that pressure more and more. Your body's going to help to stabilize there, okay? So we worked on that right hip here. We got your T12 to move, and then also we did your C7 here, okay? So we're going to see how that does, and as you continue in the office, we're going to expect to see more and more pressure off of that nerve, okay?
Okay.
All right, man, so you're all set for today. All right, man, have a wonderful day.
Thank you.
We'll see how things go from there, okay?